And welcome to Practical Parenting, the webinar Preparing a Child for a Doctor Visit. This is part of our webinar series, and we're very happy to have with us today Shannon Hood and Traci Maye from the Child Life Department here at CHKD. So we were just talking before I started the recording that between Shannon and Traci, they have over 5 years, actually 26 years of experience in child life. And we're extremely pleased to have them here to talk about how to prepare your child for a doctor visit, how to ease some of those symptoms that may come up as they're preparing to even a typical well child visit, or if they're coming in for immunizations or an unexpected sickness or injury. We really want them to feel confident and you to feel confident in bringing them to the hospital or to the pediatrician for any healthcare experience that you can be there to support them. So let me tell a bit about Shannon Hood. She has been with CHKD for 13 years, and she's the Child Life Department Manager overseeing a staff of 13. She's a certified child life specialist and recreation therapist and provides primary services in the rehabilitation unit and the neonatal intensive care. Provides psychosocial support for children and families on the road to recovery, and Shannon enjoys empowering kids to express themselves through play. Traci Maye has been with CHKD for 6 years and served as education coordinator and as the primary child life specialist in the emergency department. Traci to CHKD from Miami Children's Hospital. She worked extensively with various diagnoses in children and helping families. Traci provides immediate support to children and families coming to the CHKD emergency department and provides follow-up for children requiring hospitalization. Facing a negative hospital experience turn into a positive experience through preparation and play. So I have to turn it over to Traci and Shannon and let them go ahead and present. If you have questions during the presentation, feel free to raise your hand icon or to them in, and we will respond to them as appropriate. So take it in.
Great, appreciate it. As Michelle said, this is preparing your child for a doctor visit, and we are going to focus on a well child visit to a pediatrician, but lots of what we talk about can run over and be used in a visit to the dentist's office, a visit to the ER. So as you're listening to us speak, these tools can be used in other avenues as well.
Our objectives for today is to decrease caregiver and child anxiety before doctor visit, to open lines of communication between the caregiver and the child, and to obtain ideas on how to prepare a child for a successful doctor visit. As we go through our slides in our presentation today, we will talk about the different age categories that we have: infant, toddler, preschool, school, and adolescent. I do realize that some of you may have a child with a developmental delay, and your child's needs can be best put into whatever age group is closest to their developmental level.
So we're going to start off by fears and by talking about fears. And this is where some of our kids get their anxiety from, is actually from us. Going to the doctor can be a very scary experience for anybody. And adults, when we go to the doctor, we often moan and groan about going to the doctor and then talk about it in front of our children. And we see it on TV shows, we hear neighbors talking about it, and so our kids get these fears internally, but they can also get them from us. So kids can often be fearful of our or adult reactions, as well as the fear of the unknown. And when we're talking about specific age groups and fears, for our infant and toddler, they might not be expressing their fears or telling us their fears, but they can show it to us through the way that they're acting. They can feel the caregiver becoming tense, and so an infant and a toddler, they might start displaying signs of agitation or crying because they can feel our tension. The preschooler might end up acting out or saying no a whole lot, and I'm sure that you've heard that if you have a preschooler. The school age, they might go back to their room. They might act out. They might also start yelling, and school age adolescent might tell you their fears. And so we're going to discuss some of those a little bit more in depth as we go along today. And so the fears that we can see are fears of pain. So when you think of going to the doctor and you think of what adults have said, sometimes we talk about going to the doctor and, oh, that hurt, or they moved my arm this way or that way. And, of course, we might have gone to the doctor for something that was bothering us, a trigger, and we have told our kids about that. And so they automatically might think that they're going to the doctor and it's going to hurt. The other fear is fears of shot and immunizations. And let's face it, sometimes these hurt. And so our kids might be fearful of them. And when you think specifically about your infant or your toddler and preschoolers, they are known to do what's called magical thinking. And so they create big dramatic scenes, and they can create a whole doctor's office set up. And they might also display anxiety and fear through that magical thinking and let you know that they're scared that it's going to be painful and that these things are going to hurt. I'm just describing some of the fears of blood draws, fears of nurses, doctors, and strangers. When you think about your toddler at 18 months, they might have stranger anxiety. And also, as I previously mentioned, fear of the unknown. And so we're going to help to prepare you and then prepare your child so that things are not known to you. We're going to help you to see that we can better prepare our kids for these visits. We are going to set the stage for success. And what that means is really preparing ahead of time some practical things that you can do before you even make your appointment. So CHKD, I'm going to assume that those listening are part of CHKD practices, and if not, we have locations all throughout the cities surrounding Virginia Beach, Norfolk, Hampton, even in some of North Carolina. And so if you're listening, set the stage by finding a location that's closest to you or closest to your child's school, wherever you'll be coming from with your child. Find a location that best suits you so it's not out of the way. And then find a day or a time of day that works best for your child. So when we're looking at an infant and toddler, we want to find a time of day that meshes with their nap time. So I wouldn't schedule a doctor's appointment right in the middle of a nap. Doctors' offices are very flexible. They typically open around 7:30, 8 o'clock, and they have evening appointments. And so that might be something to take into consideration when you're looking at a location as well. Find out if your physician has evening appointments, if they have early sick appointments, if they have Saturday appointments. Find something that works best for you, because that will actually help to decrease your stress, which in turn will decrease your child's stress. You want to choose a doctor once you pick a location. Choose a doctor based on the male-female factor. If you have boys, you might want to choose a male doctor. If you have all girls, choose a female doctor, or one of each for each of your kids. As your child grows into the elementary school age and adolescent age, they might feel more comfortable talking about their bodies with the same-sex doctor. Another thing for setting the stage for success is to find novel toys. And what that means is before you even go to the doctor, find some toys that would be fun to bring with you so they serve a good distraction. You want to find things that will ease your child's fear, take their attention, and really they can become really involved with whatever that toy is or novel thing that you brought with you. So find some things, put them in a bag, and that's kind of what you would consider your go bag. Bring your go bag with you so that you have something fun for them to do while in the doctor's office. Then it's really to prepare. Know what is scheduled for that doctor's appointment so you can prepare your child. And Traci's actually going to get in more detail in the next couple slides. So we're going to breeze over that one for right now. The next thing is to answer your child's questions. And we're going to get into that a little bit as well. But when you answer your child's questions, they don't know a dramatic answer. It's real, simple, concrete responses, and tell the truth. Hey, Mom, I can have a shot today. Yeah, buddy, you are. And you'll hear me throughout this presentation say buddy, and that's because I have a 10-year-old son, and techniques that I'm talking about are actually techniques that I have tried with him, and I talk about a lot because have really won us over, and he really doesn't going to the doctor or getting shots. I feel like I'm a little bit spoiled, but I think it's because these techniques help. So answer your child's questions. Be clear, concrete. If you don't know the answer, you know what? I don't know if that's going to happen, but I can find out when I call and make your appointment. And we'll dig into that a little bit deeper in the next couple slides as well. Setting stage for success means to play. That is what a child does, and that's what your child probably does really well. Allow your child to play before a visit, after a visit, during a visit, and sit down with your child and play with your child, because we've in our department, and what we tell people is that play is your child's language and toys are their words. And so when you're sitting down and you're with your child, you might find out what some of their fears are or what some of their questions are. So it's really important to sit down and have that time with your child so that you can get to know what they might be fearful of in visiting the doctor. The next is know when to tell your child. So once you make that appointment, know when to tell them. And so for your infant and toddler, obviously they're not really going to understand, so they don't need to be told that they're going to the doctor days before. But when you're going into the doctor, just, hey, we're going to the doctor, and just even having that conversation, even if you know that they might not be understanding you. For preschooler, there's no sense telling them days ahead because they might forget or they might constantly talk about it, and it's the one thing that they think about all the time. They might lose sleep over it. So for the preschooler, I would tell them the day before they go to the doctor, hey, we're going to head out to the doctor, but it's okay to still set the stage in advance and do some of that doctor play that Traci's going to talk about as well. For your school age, that's really based on your child. If you have a very anxious child, hopefully some of the techniques we talk about today will decrease some of that anxiety, but I would tell a couple days before or the night before you can tell your school age child. And then for an adolescent, again, that's based on anxiety, but it's okay to tell them when you schedule the appointment, which could be a month out, it could be just a few weeks out or a few days out. It's okay to talk to them about it.
Talk a little bit about preparing your child and doing that through medical doctor play. As child life specialists, medical play is something that we use a lot in the hospital, and you can use it at home in preparing for a doctor's visit. The goal of medical play is to get that child used to the routines and the things that they might see once they get into that doctor's appointment, to decrease some of that anxiety and to known type of feeling. And it doesn't have to be just a doctor kit, even though we're going to go over it. You can do things with some medical supplies. So Band-Aid art is one that we use a lot in the hospital here, and it's just take Band-Aids, all different kinds that are out there now, and just put on a piece of paper and letting them make faces, abstract art out of that. That is just getting them used to being Band-Aids and letting them know it's okay to touch some of these things. For doctor, you'll need a doctor kit, stethoscope, blood pressure, all things of that nature are good to have in there. And you can go ahead and do some of your role play. I can do this with each other. You be the doctor, the child be the patient, or vice versa. Or the child can be the doctor to another patient, a doll, a stuffed animal. But you will make sure that you are rehearsing and making sure that they know to look into the eyes, ears, and mouth. Things and rehearsing for the visit during medical play might generate some questions, and go ahead and answer them honestly. If you don't know an answer to one of the questions that your child might ask, it's okay to say that you don't know, and you'll try to find the answer and bring it back to them. It's also a good time during this role play to see if there's misconceptions. A lot of doctor kits have a syringe that it's supposed to be a shot, it's supposed to be an injection type of thing. If your child repeatedly giving shots into, like, say, the stuffed animals or the doll's eyes, that's something to kind of clear up later on and discuss with your child. You know, hey, I saw where he got a shot in his eyes. Why did he have a shot in his eyes? And tell him usually where shots go. And any feelings that might come up. You know, it might be fearful at first if they've never been around the doctor equipment to kind of recoil away from it, but kind of gradually let them know it's okay to touch these things. So again, whether in medical play or not, you want to explain the visit in advance. What is expected of them? What is going to happen? So what does a well-child visit look like? Check in, do vitals. There is a vision test. Again, you're going to look in the nose, ears, mouth, and eyes, belly, feel the spine, a full body check, including looking into the shorts and private parts there. When talking about these things also, with the full body check, just make sure that you're honest with your child and use the correct terminology with them. You know, with little boys, doctor might need to check your penis. With little girls, we need to look in your vaginal area. Important for them to know those terms as they have their visits. And potential immunizations, hopefully you have found out before whether they're going to get immunizations while they're at this visit, but potential immunizations, finger poke for blood, urine check, those things.
Right, so those are all the things that you get to do while you're at the doctor. So now what do you do with that information? So what the point of our webinar is really to help to increase compliance, to explain to you what happens at our doctor's visit and how to help your kids. And so what I'm going to do is go through each of those things that Traci was talking about, and I'm going to help to give you some tips so hopefully your kids are a little bit more compliant or they're more willing to participate with you. So at check-in, when you guys walk into the doctor, allow your child to sign in. What we're doing is we are going to prepare you to give your child some control. So it's okay as a parent to step back a little bit and allow your child some control during these visits. Because I think what will happen is I know that your child will be more prepared and more willing to participate if they feel more in control. So when you get check-in, let your child sign in. If you have a toddler, all right, we have to sign you in. Can you tell me your name? And then you write down your child's name. Obviously, you know your child's name. Let them tell it to you so they feel like they're participating and they're a part of the visit. For preschool kids and adolescents, they can certainly sign themselves in. You might need to just to the area where they sign in. And then when it comes to vitals, which means they check their height, their weight, their blood pressure, their temperature. Typically for adolescents, we probably won't talk much about them because typically we would talk to them and verbalize what's going to happen. So it's really that preschool and elementary age child that I'm going to give a little bit more detail here. And in each of our physician practices at CHKD, I know that when my son goes to step on the scale and then he goes to get his height checked, at the height check, they actually have all of the different rides that he could ride at Busch Gardens. So what I say is, hey, buddy, we're going to go stand next to the wall, and they're going to see how tall you are because we want to see what rides you can ride at Busch Gardens. So it's just something fun that you can play and do. Then when it's time for weight, it's really just stepping up on a small step so they can see how much you weigh. You know what? There are no owies. There's not going to be any owies here. We're just going to see how much you weigh and see how tall you are. And for the blood pressure, typically you go back into your room at this point. The blood pressure we typically describe as a hug on your arm. So they're going to put the blood pressure cuff on your arm, and it's okay to say what it is, label the item. We're going to put that blood pressure cuff on your arm. Which arm would you like for it to go on? So if your child doesn't have a broken arm or no restriction restrictions, you can actually have your child participate by asking which arm would you like for this blood pressure cuff to go on. And they often are, nurses and clinicians are really good about allowing the child to help, and I would encourage that. So this is going to go around your arm right here, and you might feel a tight hug. So you want to prepare them that that blood pressure cuff is going to tighten up a little bit on their arm so they're prepared in advance, and help to increase that compliance. Nice deep breath in and out of my mouth with you. Let's take a nice deep breath in. So you take a dramatic breath in, so your child does that with you, and then a dramatic blowing of the air out. So and hopefully your child will follow the lead if you're practicing with them. For the temperature, we want to just see how warm your body is, and so this goes, typically our physician practices, it is just a tool that just across their forehead, potentially around their ears, so it doesn't even go in their mouth. So remember, no owies is what I would continuously say. I would always tell the child, your doctor wants to see how good you can see, or they want to see if you're not seeing certain things, because it's okay. At your doctor's visit, they might find that your child might not be able to see everything perfectly clear. So we want to be able to see if you can tell me what all these letters are on the board, or we want you to be able to tell us which direction the cars are pointing. For the younger kids, they might have different symbols or shapes or animals, and so they'll let them verbalize what the shapes are. And it is absolutely fine to practice with the child, or for you to do the test before your child does the test, to show that it doesn't hurt, and it may be a little scary at first, but look, mommy's going to do it first, or daddy's going to do it first. Test, typically it is they put a little sponge in the child's ears, how I would describe it, that's attached to a machine, and the machine sends out little beeps. And what your child is to do is to raise their hand when they hear a beep. So for your elementary school children, what I would do is you can practice. Say, when you hear the beep, you're going to raise your hand. We're going to practice once. Beep. And hopefully your child will raise your hand, and if they don't, say, oh, buddy, why didn't you raise your hand? Did you hear the beep? And some kids will test us a little bit here, so it's important that they know. We want to know how well each of your ears can hear, and it doesn't hurt. The beeps aren't very loud. So if you hear the beep, raise your hand. Is looking into the eyes, nose, ears, and mouth. For your preschoolers, it will be really important to let them know no owies, but it's really important that you hold nice and still. And sometimes I'll even move my head all around with our kids who are in the hospital and say, is it easy to see my eyes with my head moving all around? And they'll most of the time laugh and say, no, your eyes are moving all over the place. And then I'll hold my head really still and I say, is it easy to see my eyes now, or is it easy to see my nose now? And they'll absolutely say yes, and I'll say, well, it makes it a lot easier when you hold still to look in your eyes, your nose, your ears, and your mouth. There are no owies, but we need to look. So for your younger ones, like your infant, toddler age, we're going to go over positions of comfort later. But for younger ones, really encourage for you to hold your child and to hold them in your lap. So they sit in your lap, so they know that you're a close comfort to them, because for that age, they might move around a whole lot, but it's important for their mom or their dad or their caregiver to be there with them, and so they feel your presence and they know it's going to be okay. They might move around a little bit, and that's fine, but for your older kids, I would definitely give them a visual of, look, when my head is still, it's a lot easier to do these things. The thing is feeling belly and feeling the spine. Our physicians are really good with all of our kids, but for our infants and toddlers, they like to make a game out of it and maybe tickle a little bit and just a tickle, and they're really good about verbalizing, I'm going to feel your belly. As a caregiver, it's okay for you to say, hey, buddy, or hey, sweetie, your doctor's going to feel your belly now. They're going to see, and you can even joke around a little bit. They're going to see if they can feel any poop in your belly. Do you think there's poop in your belly? And I might sound a little silly saying that right now to adults on a webinar, but these are things that have proven success with our kids. At this point, too, like Traci said, they might look in the shorts. And so this is a great time to say, you know what, they're going to look in your underwear right now, and you know what, this is your doctor and mommy's here, and this is very safe, and it's okay for them to look. And this might be a conversation that you would want to have with your children as well, as far as good touch and bad touch for the future, in that, you know, mommy's here and this is your doctor, and it's okay for us to make sure that you're developing and that you're growing the way that you should, but other people should not be touching you in these places. So then the other thing with increasing compliance is potentially immunizations or finger poke or urine check. Again, for your preschoolers and elementary school kids, I would do the visual of moving my hand all around. And is it really easy to put a shot in here, or is it easier if I hold nice and still? And, really important, it's okay to be honest. If you're asked if it's going to hurt to increase compliance, I would say, you know what, bud, it is going to hurt for a second, or it might hurt for a second, but then it's all done and we can get back to playing. So it's really important to be very open and honest with all age groups for increasing compliance. And then if any of you have any questions or something specific, please feel free to write it in the little chat box. At this point, Traci is going to talk about a couple of books that are out there.
Preparing your child, you might come across some books that are designed to help kids kind of know what's going on at the doctor's, and it's perfectly acceptable to explore some of these books and see which one would be right for your child. Two that we found were Nothing Bears, Go to the Doctor. I think it's kind of written more for maybe school age, maybe preschool, older preschool, school age kids. It does a really nice job of going through the different steps about brother and sister bear going to the doctor. And thing that we just talked about going on, checking the eyes. It even goes into immunizations. Something that's probably more appropriate for toddlers and younger school age to younger school age kids is Dora Go to the Doctor. Dora is really popular. Really simple way while explaining to kids to the doctor routine. So this is the one I'm actually going to read to you guys right now. This actually is a 2-for-1 book if you're interested. It's Dora Goes to the Doctor on one side and Dora Goes to the Dentist on the other. Dora Goes to the Doctor. Oh, says Dora, today my mommy is taking me for a checkup at the doctor. Will you come with me? Great. Vámonos. First, we have to find the examination room. Who asks for help when we don't know which way to go? Map. Map says we have to go to the bus stop and take the number 4 bus to the doctor's office. Then we're to the waiting room where the nurse will call us into the examination room for a checkup.
So what Traci is reading here, I'm going to interject for a second, is everything, it's just reinforcing everything that we've been talking about so far. It's really, Dora's doing a great job preparing this child even for the bus ride to the doctor's office.
Here we're at the bus stop. There are 3 buses coming. Do you see the 4 bus? That's one that will take us to the doctor's office. Here it is. Numero 4, number 4, vámonos. Let's get on the bus. The next page, I'll just describe briefly what it is. It's a waiting room full of people and children. So the bus took us to the doctor's office. There are lots of books and toys to play with in the waiting room. In a few minutes, Dr. Lopez will be ready for me. Pilar calls me into the examination room. It's time for my checkup. First, Nurse Pilar weighs and measures me to see how much I've grown. Do you know how tall you are and how much you weigh? Then Nurse Pilar takes my temperature by putting a thermometer in my mouth. My temperature is just right. Now time for Dr. Lopez to come in and examine me. First, she goes to listen to my heart with her stethoscope. Then lets me listen. It goes, what does your heart sound like?
So in this, Dora is going through and listening to her own heart, and that does happen at doctor's visits. Our physicians are happy for our kids to take some control and to listen to their heart first. And so it's a great way for your child to become involved. Allow them to listen to their own heart and to tell the doctor how their heart sounds, and then the doctor can take back over from there.
And just to reinforce some of the things that Shannon says, the reason why I like this Dora book is, in typical Dora fashion, it's putting it back on the child to answer. So, you know, how does your heart sound? What does your heart sound like? Get some kind of thinking what it is. To the next page, a picture of several tools of the doctor: the reflex hammer, stethoscope, otoscope, tongue depressor. The next tool Dr. Lopez needs is the little hammer to test my reflexes. Do you see something that looks like a hammer? Dr. Lopez taps both my knees and makes them jump all by themselves. Dr. Lopez asked me to open my mouth wide and make an ah sound so she can look at my throat. Will you make an ah sound with me? Ah. So really good, because again, the child is practicing when at the doctor's. Then Lopez takes a little stick called a tongue depressor. It looks like a popsicle stick. She gently presses on my tongue so she can see my throat. Her next tool is something called an otoscope. It's a little light on it to help her see into eyes and ears and nose. The thing Dr. Lopez does is feel my tummy. She presses it a little bit all around. That tickles. My chip is over. Dr. Lopez used all sorts of interesting instruments to make sure I'm healthy. And I am healthy. Can I lose? Maye says I was very brave at my checkup. Says you were too. I could have done it without your help. Yes.
Oh, thank you, Traci. So in this book, it does show pictures of toys in the waiting room and kids holding toys. And due to infection control reasons, our practices might have a few things. They have fish tanks to look at. But this is why we encourage you to bring a go bag with you, to have something for your child to do, and to help to increase compliance. So reading the book beforehand, preparing. Also, break out that go bag. So if your child starts to have a meltdown, it's okay. Break out one or two of those unique toys that you brought for your older kids, for your adolescent. Let them bring their phone. I'm sure they'll be texting their friends or posting on Facebook, and allow them to do that. It's okay. These are great ways to also help to increase compliance as you throughout your visit. So you are preparing your child, you've read the book, you have done everything we've talked about so far, and it's really important to check in with your child. Do they have any concerns? And so the first thing I would do is validate their concerns. You know, Mom, I'm really scared of going to the doctor. And it's okay to look at them and say, you know what, sometimes not knowing what to expect can be very scary. So it's okay to validate that you understand it's scary for them. Don't dismiss what they're saying, because what they're saying is a true fear for them. So we want to make sure, again, that we're validating, that we're not dismissing it, and that we are encouraging questions. We want this to be a positive experience, so allow your child to ask questions. Hopefully you'll be able to get some of the answers. For most practices, you can go to the webpage to potentially get some of those answers to questions. When you schedule your appointment, maybe have this conversation have a conversation about questions prior to your appointment, so that you can have a list of questions and ask as you're making your appointment. You know, I just wanted to know, is my child going to have immunizations at this checkup? Should I expect a hearing test at this checkup? Should I expect that we're going to have any labs or blood drawn during this checkup? It's okay to ask questions, because as healthcare workers, we really want this to be successful too. There's nothing more concerning or stressful for us as a child coming in that's stressed. This is why we're doing webinars like this, is because we want to increase the success for your child and for us. What we're doing now helps to build upon how their office visits go in the future. So ask questions. We're happy to answer them for you. And encourage dialogue with the doctor. So when you are in the room with your child, I always have my son, I always say, hey, bud, do you have any questions for the doctor? You remember waking up in the middle of the night and you've been super hot and sweaty and you were going to ask the doctor about that. It's okay to trigger their memory and allow them to ask questions and just have some dialogue with the doctor. That's very important as well. All right, so now we're going to get into really what is the day of the visit. What does that look like? More on the emotional side and what you should do the day of visit. So the day of your visit comes, what we would do is really encourage normal activity. We want going to the doctor to be a normal thing, so let your baby take normal naps, eat and drink normal, unless your physician has said that they shouldn't eat or drink for a specific reason or if they should stay awake for a specific reason. For your preschooler, for your school age, and for your adolescent, send to school. Don't let your child talk you out of going to school just because they're having a doctor's visit. Let them know, you know what, that's just part of your day, but you have to go to school. So I would encourage them to go to school. And again, when you're looking at making your doctor's appointment, find one that's the best time for you. That might not always be feasible, but find a time that might be either before or after school or during a lunchtime. Then the day of a visit might be where you see your child having some concerns or feelings start coming out like, Mommy, I'm really scared, or having some anxiety or crying, and be there with your child. One of the things that we say with our families here is we might not have the best words or the right words to say, but be present with your child. Allow them to feel that you're there with them, that you're concerned, that you love them, and validate those feelings. But also some of them, you'll be able to answer some of their questions if you're prepared in advance by speaking with the physician or knowing what to expect. So it's the day of the visit. You know what to do. You're headed out the door now. So as a caregiver, it's really important that we remain calm and patient. If we are stressed out, we, I say me, I mean me as well. If I'm calm, I know that my child is more calm. If I'm stressed out, that means that I might be yelling a little bit or I might be short with my child. So take a deep breath and really that you might be expressing some of your fear or anxiety about going to the doctor. So it's important to just do a self-check, be calm, be patient, have your cup of coffee, be ready to go. Now, as far as your child goes, they might act out, they might cry, they might express various emotions, which we briefly touched on, and that's okay. If they're saying, I can tell that you are upset, and that's you validating their feeling by saying, I can tell that you're really upset, or they're crying, I can tell, it seems that you're really sad. It's okay to label that emotion, and they'll tell you right away if they're feeling sad or if they're not feeling sad. So if you improperly label how they're feeling, they'll let you know. In our experience, they'll let us know, and then they might label that feeling for you and say, no, you know what, I'm not sad, I'm just tired, I want to go back to bed. And so there, we've cleared that up. But as a caregiver, it's important to be calm and to be patient with our kids. When our kids are stressed or acting out, sometimes it's hard to be calm and patient, but this is a time that's kind of scary to them, and it's good to recognize that in ourselves.
Headed to the doctor's office and done your check-in, and the next thing is to wait before being called back to examination rooms. So what do? You bring out that to-go bag, get those distracting items so they have something to do. If you have a truly anxious child, some of these things and from the to-go bag will alleviate some of that anxiety, and it's something normal that they do. Shannon was talking about new and novel toys to get their mind onto something, you know, a new challenge type of thing. If they like playing with the phone, you might have downloaded a new game for them to play while they're waiting. But also, some of the more familiar objects I don't think we talked upon before that kind of help comfort this kid. So if they usually go around, you don't know how many love kits that I've seen being brought to the emergency room when kids come and that they've had since birth. If that's what they bring with them for comfort, let them bring it with them. The blankets, the stuffed animals, if they have, they're going to help them decrease anxiety while they're waiting. Also, while waiting, you can review the steps of the visit. Remind them that the next thing to do is to be brought back to the examination room. Remind them that the doctor is going to look at your ears, nose, and mouth, and help them along the way. So finally, you get back to the examination room, and the visit has started. So we want to be calm and patient and honest, because those things are going to reflect it back on your kids if you're not to make this a successful visit there. Along being patient, you need to give them some encouragement. As we said before, going out the door, some emotions might occur, and it'd be a little bit of apprehension once they get back into the room with the doctor. Again, give them encouragement. You know, hey, remember we read about this in the book, or you did this to the doll, or when we were doing the medical play, and it's okay to be a little scared, but I'll help you kind of through it. Bring questions and concerns for the doctor, like Shannon was talking about before. You need a little prompting to help the kids kind of have that relationship with the doctor as well. So when the example about, hey, remember when you kept waking up at night? You want a doctor to know something about that. Also, as you get some of their adolescents, they might have some questions they want to ask the doctor about, but they're kind of embarrassed to ask around in front of their parents. I would encourage them to have a little one-on-one time with the doctor so they can ask those questions. It's instilling trust in the doctor and in trust in the child that they are able to say that to the doctor. Concrete language. You know, sometimes in the field there's a lot of different words that that can be misconstrued by kids the younger they are, the different things they do. So, like, I know, for instance, if for some reason they do need to give a stool sample, they probably wouldn't during a well visit. But you know, what does the word stool cause in a younger child? Something that you sit on. So we want to make sure that they understand the language that we're giving them to help explain the visit and what's going on. And throughout the visit, especially in those instances there might be a little anxiety, you want to provide some positive touch. So that's hand-holding, hugging, just encouraging them to do what they need to do. And that's okay. In the hospital that we have developed, Child Life has developed some comfort holds, kind of help those kids be controlled, be a little bit more comforted, help with their anxiety if they're having any. And if you see here, probably going to the doctor's office, probably the back to chest one will be used quite a bit. You can use these for different things, like when they're checking their ears and their nose and their mouth, when looking into their eyes. There's some other comfort holds there, and it's just, you know, that skin contact that the kid would alleviate their anxiety during examination. Down at the bottom, if you see here, just some little things that help your child's hope. So while you're doing that, you might count or say ABCs or see how long it takes for them to get through the exam.
Thing that we didn't mention is for infants and young toddlers. If you're a nursing mom, it's okay to ask the physician if you're allowed to nurse through the exam, or if a baby needs an immunization. Most of our physicians are very open to that, and if that is something that you feel like will provide relief to your baby, just ask ahead of time and let them know that that's what you would like to do to help to provide comfort. So hopefully you have gotten some ideas on how to comfort and prepare your child. And so now we've gone through what to do before, during, and now it's after the visit. And you might still be in the room, you might be headed out to the car. but it is after the visit, and you can wipe your head and say, whew, we did it. Because going to the doctor can be hard and scary for kids and parents. Excuse me. What I would really encourage you to do is praise your child. So praise them for something specific that they did that was good. So what I do is, you know what? You did a great job holding still so the doctor could look in your ears. Were able to see so clearly and see that your ear was clear, or maybe they were able to see that you didn't have any wax in your ear, or you did so good opening your mouth really wide for us to see. And it's those specific things that you're praising your child for instead of one general. Something specific goes a long way. What? I'm not going to lie. Some of these visits might not go as well as what we're talking about, and your child might cry through the whole visit if they've missed a nap or if they're getting sick or cutting teeth. Some of these things just might not work for you, and that's okay. But after the visit, still praise your child for something good. If they cried through the whole thing or if they screamed that something hurt, you did a really good job telling mommy that didn't feel good by screaming. Thanks for screaming. And even though you might feel like, man, I really don't want to say that, let them know that they did a really good job telling you that something didn't feel good or that they didn't want to be there by telling you. Next thing is really encourage healthy habits. If your physician gives you some advice on on exercise, then model those behaviors with your kids. When you leave, you know what, your doctor is talking about our family needs to get some exercise. I think it would be fun to do together as a family. What do you think would be fun for us to do together? If you have a dog, walk the dog, or we could go to this park and walk to the park or ride our bikes to the park instead of driving or taking the bus. And then the last thing on here for after the visit is consider making a new routine. So what that means to us is before after we leave the doctor, what I would like to do is take you to get a new book or take you to get some frozen yogurt. We want to celebrate this success by doing something, and it doesn't mean that you have to buy something. It goes back to spending time with your kid and just being present with them. So, you know what, after a visit, why don't we go for a walk, or why don't we go to the park? Something fun, something that would be fun for your child to know that you care for them and care about them, that you're going to do a specific new routine, essentially something that your child will look forward to. So we hope that some of these tips and tools are going to be helpful for your visit. Some of them might seem really simple and easy. Some of them you might think, oh, that's not going to work. But we really encourage for you guys to try it. Traci and I, as Michelle had said, we've been here and in our or certified in what we're doing for almost 26 years. But that's exciting to me because it means that what we're doing has worked. And the advice that we give to parents and the advice that we take on our own, it really works with families. So I encourage you to give some of these a try. If you have specific questions or concerns, feel free to type it in the text box. We would love to be able to answer some of those for you.
This is Michelle, and the other thing you could do if you have a question is you can raise your hand icon. There's a little picture of a hand there, and if you click on it, it would show up next to your name. So it looks like we have two participants that actually are on the phone but muted, and we could unmute you if you have a specific question.
If you guys are thinking of questions, Traci and I specifically work out at the hospital. And we do have kids who go to the doctor and they do find something, and they might need to come in for a specialist visit, or they might need to come in and have surgery. And on Tuesday nights, we do offer a pre-surgical tour. And you'll see that in the chat box. It says from Shannon Hood to all participants. We have a Tuesday night pre-op tour, and you can call the phone number that's listed, 668-6148. Schedule for your child to come in, and what we do is we do some medical play and preparation. We show pictures of what the waiting room looks like, what the operating room looks like. What we do is we go over what the child will hear, see, feel, smell, a little bit more prepared, just as we did in our webinar with you. We do that use some different words, some different language to prepare your children to go back into the operating room.
I have a question here, Shannon. Any recommendations regarding a visit to the dentist?
Well, Traci, do you want to answer that, or do you want me to?
I think it's important because I think it's a lot similar to going to the doctor. You want them to kind of know what's going to happen beforehand. And like I said, the Dora book that I read from is actually 2 books. So Dora does go to the dentist on the other side, and they talk about what's going to happen there. Some of the things that you might want to use in preparing a child for going to the dentist. I know that when I was younger, well, like the Play-Doh, I don't know if they have it anymore though. Dr. Teeth, as you actually could, mold Play-Doh teeth, and they had a little dental mirror, and you could check out the teeth there as well. So if you find any toys that kind of relate going to the dentist, I know that Playmobil has a couple of play sets too about the hospital, the doctor. They might have one at the dentist as well. They have several of those to kind of rehearse what's going on.
Another thing to answer that question about going to the dentist is to get them there early. So I think I first brought my son to the dentist when he was maybe 18 months, 2 years old. So if you have dental insurance, they will cover that. And what they do, I would tell your child they're going to count how many teeth you have. They are going to brush your teeth. What they do is fluoride. And so the way that the hygienist does that is they take a paintbrush and they paint the fluoride on their teeth. And so that's something easy where at home you could get a little paintbrush that's brand new and just practice with water painting on the teeth. And so that would be a great way to quote unquote do medical play. But really when they're young, they like to count teeth. They like to brush for the kids and put the fluoride on with the paintbrush. And so I would prepare them that way, but also let them know it's really important. Their hands are going to be in your mouth, so we need to keep your mouth open and talk about how if they were to bite down, that would hurt. Your dentist and hygienists have been bit before, so they're prepared for that. But I think if you go in ahead of time telling your child what to expect, that'll be really helpful. And Michelle said, you'll see a chat box on that book, The Dora Goes to the Doctor. On the flip side is The Dora Goes to the Dentist. There's also Doc McStuffins is a great resource. She is off the press. Lots of kids love her. I don't know if she has anything about the dentist, so hopefully some of that information is helpful too as well. Thank you so much for listening, and we hope that some of the information was helpful to you. And if you could even just glean one thing and take it away with you, we hope that it helps to increase your success of going to the doctor with your child. Thanks for listening.
And Traci for the wonderful information. I think it's been very helpful and enlightening. I just want to mention that we do have a calendar of events on our CHKD.org website, chkd.org/classes if you're interested in other information. And we also have a parent resource page, so chkd.org/parent resources. We have some pre-recorded webinars there, and this particular webinar will also be placed there if you want to re-listen to it. I know we had a couple people join, so if you wanted to catch up on what we said, they'll be up probably by the end of the week. And other than that, we do have some webinars there on basic child development, toilet training, sleeping, lots of different variety there for some of our CHKD experts. So thank you to Shannon and to Traci for being here. And if anybody has a last-minute question, we'll give a couple seconds here. And other than that, if you need a certificate, please email michelle.tron@chkd.org. And also, if you'd like a copy of the PowerPoint, you can read it at the same email. And I'm recording.